or comments in using the chat function. And as discussed, once the PPE training starts, they'll put the QR code up that you can use to register directly. We will prefer that you use that code because it allows it to flow straight through to the database without requiring manual data entry. But also, if you pop your name and HE number into the comments on the chat, it means that if any of the QR codes don't upload, we've captured your attendance. So can I open by saying, Kaya, Wandju, thank you for joining us, and we acknowledge the traditional owners and custodians of the land, the Whadjuk people of the proud Noongar Nation, and the care that they have showed for the land and waters since the beginning of time. I extend that acknowledgement and respect for Elders past, present and emerging to any First Nations people that join us here today. I just want to acknowledge the times that we're going through. It's been a very busy time for quite a while now, and it is a stressful time as we move into status amber for the system. So we are now on system alert level amber. That means it's time for us to be ready to respond as we start to see increasing COVID cases in the community, and therefore amongst our workforce and also in our patients. You may or may not be familiar with this document, which is now our Bible. This is the system alert and response document. So if you saw the global that came out from Russ, the Director General, yesterday, there is a link to this document in it, and it explains what it means to be on full amber. For those of you that are familiar with the document and just want to see what's changed, it's the grey stuff in here. So when we were on amber interim, there was some wording that was greyed out that is now in effect. But what does it really mean for us as a system right now? So our PPE requirements do not change. Staff in ED are still required to wear N95 masks. You're still required to wear N95 masks when appropriate, depending on the patients that you're caring for outside of the emergency department. All staff are required to be in surgical masks once you come onto the hospital site, and remembering that that includes from the moment you come into the hospitals. So please make sure that you take a surgical mask home with you for the following day if you tend to wear cloth masks outside of the hospitals.
Janet, you're muted.
Thanks, Lara. Did you hear take a surgical mask home at the end of your shift to wear to work the next day? Very good. So that you heard the important bits. The other part of this for clinical staff in patient-facing areas is that eyewear, so your goggles or your face shields, are critically important to stopping the spread of COVID. And you'll hear about that in the PPE training session, but that's been one of the big lessons from the eastern states around eyewear, particularly with Omicron, as has the information that you'll hear about how to don and doff PPE. And for many of us who've been clinical for a long time, the risk is thinking that we've been doing this for a long time because COVID is a new set of circumstances. So the PPE training is really important. Once we've moved through getting everybody compliant with the basic training, then the focus is going to move into auditing. And you may have seen that we're training Ppe Spotters. So if you are particularly in a non-clinical function and you are looking for ways that you can assist in the COVID response, training as a Ppe spotter would then mean that you would be allocated some time in a clinical area to watch people, to be able to say to somebody, oh, you've forgotten this, so that they keep safe at all times. While we don't have spotters in place, we're really encouraging staff to buddy for one another, so that if you notice that your colleague hasn't put their mask on right or has forgotten their goggles, that you always say, hang on one moment, you haven't got your goggles on, so that we keep one another safe. I think that the biggest change that we see from the framework is around RAT testing And we'll talk about that more extensively after the PPE training. So we've got about a half an hour after the PPE training finishes to continue to talk. Sasha, I'm just going to mute you. Thank you. To follow up, and we'll talk about rat training, rat testing, not training, and what that's going to look like. So which of our patient groups, which of our staff groups, and what's going to be in place for Tuesday of next week when we move to full amber. So we have to have everything in place ready for Tuesday. Before we start on the presentation, I want to talk briefly about vaccination and the booster requirement. There's still a number of people who are on our list as not currently appearing compliant on the system for the deadline tomorrow. Can I ask whoever's joined to just mute, please? And so we are working with our staff. Now, I know that there was a message sent out which was in error yesterday and today and had the wrong dates in for people and is causing some confusion. So we apologise to anybody who's received that error by mistake. If you go through HealthPoint and use your self-check, those are the correct dates and your manager will follow up with you directly. We also understand that some people have had trouble with the upload of evidence, and so what your manager will do is ask you to also give them a copy of your evidence and to send it through to the North Metro email address, and we will just pop that in our spreadsheet to make sure that we can support our staff so you're not then getting followed up on multiple occasions. If you're having any trouble accessing vaccination, please let us know. We can absolutely link you into staff vaccination through the hospitals. And if you are waiting on an exemption, have any sort of extraordinary circumstances, please work with your manager. If you haven't reached your compliance and don't have an exemption in place by the date at which you're due, then we move into a process of not being able to attend work and we can't pay you during that period. So it's really important that you work with your manager to make sure that we have your evidence. The third thing on the triple dashboard that looks at PPE training, vaccination, but also fit testing. So we've got really high rates of compliance for Sir Charles Gardner Osmond Park with clinical staff having had their fit testing done. And that's because staff in patient-facing areas have been prioritised for that because that's where the level of risk is. Someone's not on mute. Can you just mute yourself, please? And so as our clinical staff fit testing is complete, and that's the process which determines what is the right N95 mask for you. So which mask fits you correctly so that you don't have air leakage around it and so that you are properly protected. As we work through our clinical staff, we're also asking that our non-clinical staff register for that, for the point at which N95s will be required more broadly. So it is important that everyone across the organisation is fit tested so you know which mask you should wear. And then you will get a card that'll tell you always what your masks are so that when you go into an area you can find the right mask, because I can't remember mine without my card. The last thing that I want to talk about ahead of the PPE presentation is really about good COVID hygiene. So when I think back to sort of same time last year, there was a great awareness about physical distancing, about hand hygiene, and particularly the use of alcohol, gel, foam, whatever products available, and the general cleanliness around. The lack of restrictions in the broader community can lead to some complacency both inside and outside of work. And when we look at where people have become contacts around the system, we notice that often it is in the tea room. So when people are eating or drinking together in the tea room and have masks off, or where people have been in shared offices and have removed their masks, which isn't consistent with the guidelines, but also actually where people have been socialising outside of work and not infrequently with each other. So it is important that we remember that despite some of the rules in the broader community, We really need to observe physical distancing in the workplace. It's one of the really important measures to ensure that if we do have a positive case in a staff member, as we will continue to do, that we're not then having to furlough other staff. Somebody's just not on mute that's just joined us. And so that we can reduce the impact on our workplace and being able to provide care to our patients. And I think, sorry, whoever's not on mute, can you just mute yourself, please? And your phone's ringing. Thank you. So that adherence to hygiene, and I think it's easy to think we're 1.5 metres apart, but the other day I realised I could not actually hold my 1.5 metre tape measure from fingers to fingers. Other people might be able to, but my arms are just too short. So it is actually quite a distance apart. So all good hygiene measures in that sense and encouraging them. The other thing to note as well is that if you are coming onto sites and you don't have your staff ID, Warren, are you measuring your arm span?
You caught me.
I was going to suggest that you would be able to, because you've got much longer arms than I do.
Unfortunately, I don't have a metric tape measure, but I can do 5 foot.
Very good.
Thank you.
So if you are coming onto site and you don't have your staff ID, you will need to go through the check-in process at the front door and reminding everybody that you are expected to then behave with courtesy and kindness towards the people who are on the front door checking people. They're often volunteers. They are subject to a fair amount of unpleasant behaviour from members of the community at times based around the restrictions, but they're doing their job to help keep us and our patients safe, which is what we're all here for. And it's even worse for them when the place that they're being subject to unpleasant behaviour is actually from a colleague. So please remember to be patient, and if you carry your ID, you'll be able to come in through swipe entrances. Okay, I am going to hand over to Anne Kimberley and the team who are in the Mary Lockett Theatre for the PPE presentation.
Okay, thanks, Janet. Can everybody hear me? Great. This is a great opportunity and idea to stream our PPE training session to as many staff as possible. So thanks for the opportunity. Just to let everybody know who's on MS Teams, that at the end of the session we'll be able to go into the attendance list on MS Teams and see who's been here for the period of the session, so we can put you on campus from there. But if any of you are sitting in a group and watching Teams together in a group on one HE number, we won't capture you. You will need to email your names to CNE so we can capture you and get you on Lattice. So my name is Anne Kimberley. I'm Coordinator of Nursing Education at Centre for Nursing Education, and we've been running this PPE training session for some time now. It is the standard session that we are running and have done for some time. It will be going on to e-learning soon, just to give you a heads up. But for now, we run it because we've got a practical component where you can actually see someone donning and doffing. So that gives you an idea of hearing about it and then seeing it as well. So the objectives of the session, I have a, thank you. I'm not shared. Just bring you up the PowerPoint. How do I know it's up there? Good to go. Okay.
We can see it, Anne.
You can you see the QR code? You can alternatively take a picture of that QR code and you'll come up with a form that you can fill in, which will note your attendance at this session. All right, thank you. So the purpose of this session is to identify where and how you can access your fit tested respirator, to talk about the personal protective equipment needed for COVID-19, how to safely don and how to safely doff your PPE, and what constitute a PPE breach and who do you notify. We'll start with fit testing respirators. We know that correctly fitting PPE is one of the greatest defenses we have against airborne illnesses, such as COVID-19 in our hospital setting. And this includes a fit tested respirator. And many of you will already have been fit tested, and you'll have your card and it'll tell you which 2 respirators are specific to you that you can don when necessary. So I'm just in the room here with some people. For those of you on MS Teams, I'm just going to ask the group here, can you put your hand up if you've been fit tested? Excellent. Can you keep your hand up if you know right now which are your 2 fit tested respirators? Great. And just keep your hand up again just for another minute if you know how to locate your fit tested respirators. Great. Okay. So for those on Teams, all the hands that went up at the beginning aren't the same hands up at the end. So when we've been fit tested, the end point is that you know confidently where to access your fit tested respirators. So all the clinical areas have ordered respirators. So if you're unsure, ask the nurse manager in the areas that you commonly go to or work in, and they will let you know where you can find your particular respirator that will keep you safe during these times. So following the fit test, it's your responsibility to wear only the respirator that you've been fit tested to, and more importantly, to perform a fit check every time you don a respirator, which could be every 4 hours if you're wearing it for a whole day. So later in the session, we're going to talk about how do you do a fit check, because it's not on properly unless you've done your fit check. If you are not yet fit tested, just to say that you can go to HealthPoint to book your fit test. It's in the orange, it's under the orange COVID information tab, and you will find it there, the yellow section that says book a fit test. You can also find a phone number there, and you can also email someone if you've got any questions or you're having any trouble. So into the signage for COVID areas. So this is the signage that you find in COVID areas or wards, where it is the precaution signage for all confirmed or suspect or probable COVID-19 patients. But there's more signage that's more specific to PPE. So if you're not donning PPE a lot, or you are donning PPE a lot, this is the signage that you'll need to follow. So on the left-hand side, it is the steps for donning. There are 6 steps on, 8 steps off. So if you look at the left-hand side, the sequence for donning, you perform hand hygiene at the very beginning, and you perform hand hygiene just before you put your hands into the box of gloves to optimize the alcohol-based hand rub effect, just before we all put our hands into the same box of gloves. So 2 moments of hand hygiene when you're donning. When you're doffing, you will notice that there are 4 moments of hand hygiene after you take off each piece of PPE, which is considered, whether made or not.
It's the bloody PPE training.
So each piece of PPE is considered to be contaminated. So every time you take off one piece, you need to do hand hygiene. So we'll go into that in a bit more detail. 6 steps on, 8 steps off. The order of which you don and doff your PPE is not really negotiable. It needs to be according to those steps in that order every time. So we did audit our organization, our group, in December last year. And we noted a compliance rate of between 55 and 60%. So as we move into 2022, that is a compliance rate that we want to improve. Correct PPE practices that I've just mentioned from the signage are essential to prevent the risk of COVID-19 transmission. So the purpose that we have all these steps in place is to minimize transmission of COVID between healthcare workers to your surrounding surfaces, to minimize any risk of transmission in the hospital setting. What we're focused on now, I mean, policies and guidelines are emerging all the time. So what we're looking at now is PPE breaches. So if something does happen, which happens, that we are all familiar with what is a breach and what do we do if there is a breach of PPE to protect ourselves and those around us. So where a healthcare worker is suspected to have a breach in your PPE, a risk assessment will be performed, and this has been updated. It will be performed by the OSH, the Occupational Safety and Health Department. So examples of PPE breaches are damage to PPE during patient care, a failure by the healthcare worker to wear the proper PPE for the precaution, or incorrect donning and doffing. So the next two slides will show a bit of detail from the audits that we did last year, which could have been potentially reportable breaches. So we must really stick to those 6 steps on and 8 steps off. And you don't have to memorize them. You can stop and just read the signage each time. So PPE breaches are immediately, as you can imagine, straight away. If you think you've breached, or someone has says, I think you've breached, they've observed it. We want a culture where a breach is not a negative, punitive thing. We want a culture where a breach is us looking out for each other and getting onto a situation that may need managing straight away. So once a breach is reported, it will go one of 2 ways. It will be assessed by the OSH department, and they may say, actually, no, that's not a breach. It's okay. Or they will say, yes, that's a breach. Let's put some systems in place to keep everyone safe. So the other thing that we have in place, which you didn't have in December last year, is we're training Ppe Spotters. So those spotters are trained, extra trained, to understand what is a PPE breach and how we can be out in the clinical setting, watching people and observing them and supporting and guiding them when they're donning and doffing, to either fix some errors in PPE donning and doffing, or to prevent breaches from occurring, or to report breaches when they do occur. So we can lock them down, excuse the pun, pretty quickly. So these were the audit results. We also audited in 2020. So we can see just from the top one, I won't read it in detail, but gown application is something we still need to get right. It may seem pretty straightforward, but I'm going to show you the steps of how to put it on correctly in a moment. The fit check, which is what you do every time you put on your respirator, was not done all the time. This needs to be done every single time you put on your respirator. Protective eyewear, I think we're going to audit from next week onwards. And I think the message about needing protective eyewear every time is already here, because we're wearing it now anyway, just as a day-by-day course. So protective eyewear was not used all the time. Hand hygiene moments, we need a little bit of improvement there, and we need to follow the sequence better, but that has improved since 2020. In terms of doffing, the risk of transmission of COVID, as you can imagine, just logically is higher. We've been around a patient with COVID or suspect or probable COVID, so we need to be quite contained in how we're doffing. So doffing gowns, doffing masks, and doffing eyewear has room for improvement. The goggles are reusable that you have on today, so you can clean them with a Clinell wipe. You cleaned on the inside first and then the outside, and they can be reused. But we are improving in our hand hygiene moments and our sequence, but still room to improve. So let's talk about hand hygiene. The 5 moments of hand hygiene apply when you're providing patient care. That hasn't changed. What has changed is how we're doing the alcohol-based hand rub. It's not really changed, it's just when we're doing it. So does anyone know how long we should be rubbing our hands for when we're doing an alcohol-based hand rub? 20 seconds, absolutely. 20 to 30 seconds, but most importantly, until it's dry so it can have its greatest effect. So how many moments of alcohol-based hand rub are there during donning? 2, doffing, 4. Really important that we remember those steps. So we look at them in a bit more detail now. The donning sequence is gown, mask, eyewear, glove. I have a way that I remember it. It works for me. I don't have a nice little short tune or an acronym to help us remember, but GOMEG is gown, mask, eyewear, glove, and that works for me. So that's what I think about when I'm donning. So the gown goes on first. It must cover the whole body, and it must be tied at the neck and the waist. So we need to take the time to tie it properly so that we're protecting our clothes. The respirator must fit properly, and it must be fit checked every time. We've mentioned that. The eyewear, you can choose either the goggles or the face visor, equitable, depending on your own choice. And then hand hygiene, and the gloves, when you're putting them on, must cover the cuffs of the gown. When you're doffing, It's a gloves, gown, eyewear, mask. So there's a certain way we're going to show you to take off your gloves safely. The gown has that risk of spreading the COVID, so we're going to show you how you take that off, turn it inside out, keep it in a small contained ball while you dispose of it in the bin. The eyewear, we don't want to take anything off from the front of our face. Even though we've taken off our gloves and we've done 2 lots of hand hygiene, you want to keep your hands away from your face. So everything comes off from either the side of the head or the straps over the top of the head. So we're going to show you that now. As with everything, we should be bare below the elbows in the clinical setting. And the first thing that you'll remember we do is the hand hygiene. So what I'm going to do is I'm going to ask Kirat, who has kindly volunteered to show us, and I'm hoping on Teams that you will be able to see that. Let's get some feedback from Teams. Do I just click on this? Thumbs up if, oh yes. Okay. If you stand on the X. Yep. Yep. Okay. Good. Great. So the camera is just there. Yes, that's it. That's it. Perfect. Thank you. So the gown is the first thing that we put on. So hand hygiene first. Thank you. And then the gown is selected according to your size. So you may know your size for gown, small, medium, large, or you may need to try one on and see. It must be long sleeved and it must cover your torso. So the opening's at the back, but the opening must be crossed over to ensure it's closed. The most important thing with the gown is that it is tied, that we take the time, and for some of us with long hair, it can be quite difficult. Certainly I would have my hair up in a bun like that if I were Kira putting on a gown all the time. It must be tied in a bow. We can tend to rush and then put it in a knot, and then when we're trying to take it off, we have to snap it, which has obvious risks. So these are large gowns because they're training gowns. They're one size fits all. So we could probably wrap around Kirat a few times. But Kirat will tie the bow at the waist, at the side. She won't tie it at the front or the back. It must be done at the side in a bow. And then do I just click? Great. So go Meg. So the next one is the mask. So this is Kirat's own respirator that she's fit tested to, which is the Halyard. I've got a few videos further on that's going to show you how to fit check this respirator. But some of these, if you haven't put them on before, can be challenging, especially these flat ones. You need to get your chin underneath. You need to get the straps out. Yep. Right. And you'll notice as the bottom strap goes on first, and it needs to be at the crease and the crack, crease and the back of your neck. So if Kirat is straightening the straps, which you have to do, because what you're aiming for is a complete seal around the entire respirator. So if you've got any twisted straps, you might have a tiny little area that's not perfectly sealed. So she'll mold it down on her nose, make sure it's under her chin, and then she'll do the fit check, whereas a diamond check at the top to check for leaks, and she'll put her palm of her hands together and check for any leaks underneath. And she can also do a deep breath in and out, and the mask will go in and out, and she'll show that it's got a good seal. Now, if you're wearing glasses or spectacles, you will need to take them off to don your respirator safely, because you don't want the earpieces of your glasses underneath the straps. They need to go over them for the reason that we want to get you the best seal, the whole point of respirators. So eyewear. Now, Kirat has chosen the goggles. If you wear spectacles, there are larger size goggles that you can put over spectacles, or you can choose the face visor, which is a single use only. So is the slides going forward? Not really, I'll just click them. So I'll click forward for those on MS Teams. So hand hygiene, just before we dive into the box of gloves. And then when donning the gloves, you want to pull the gown down, the cuff of the gown down halfway to your hand to make sure that you cover that white component of the gown. Not sure we got the right size gloves for you. So once Kierat's donned the second glove, I'm going to show you the 3 videos about how to put on your particular respirator. There are 3 types. There are the Hygiene Pro Shield, which you may be fit tested to. There are the cup type respirators, or there are the flat respirators, flat types. And you fit check them all slightly differently. So it's important that at some point you see how that works. Just move to the video. Thank you. Excellent.
Flat style respirators. There are 2 types, the SCGOPHCG Pro Shield and the Hygiene Fluid Shield. Open the respirator up, placing your index finger between the straps of the respirator and bringing the respirator to your chin. Leaning forward, placing the top strap at the crown of your head and the bottom strap at the crease of your neck. Confirm both straps are flat against your scalp, free from your ears, hair and jewellery. Using both index fingers, with equal pressure, mould the metal nose and band across the bridge of your nose and cheekbones. Step 1. Diamond fill for air. Hands together in a half diamond. Place slightly above the respirator, breathing in and out to fill for air, escaping. Palms touching, place your hands underneath your chin. If no air escapes the respirator seal, you may continue. Step 2. Puff test. With a mirror or colleague, inhale and exhale sharply. Again, no air should escape the respirator seal. If there is no air escaping the respirator seal and you feel comfortable and confident in your fit check, you may proceed with your duties. Flat style respirators. There are cup style respirator, the 3M 1860. Holding the respirator in your non-dominant bottom strap to the crease of your neck, finding the top strap and taking it to the crown of your head. Confirm both straps are flat against your scalp, free from your ears, hair and jewellery, with no twists. Generally, this respirator has a firm noseband and doesn't require moulding. Every time you don an N95 P2 respirator, you must perform a fit check. Diamond feel for air. Hands together in a half diamond, place slightly above the respirator, breathing in and out to feel for air, escaping the respirator seal. Palms touching, place your hands underneath your chin. If no air escapes at the respirator seal, you may continue. If you feel comfortable and confident in your fit check, you may proceed with your duties. Modern flat style respirators include the 3M 1870 Plus and Trident model. Holding the respirator in your non-dominant hand, taking the bottom strap of the respirator and placing it over your middle finger. Opening the respirator and creating a cup. Placing the respirator underneath your chin and taking the strap from your middle finger and placing the bottom strap at the crease of your neck. Finding the top strap and taking it to the crown of your head. Confirm both straps are flat against your scalp, free from your ears, hair, jewellery and twists. Using both index fingers with equal pressure, mould the metal noseband across the bridge of your nose and cheekbones. Every time you don an N95 P2 respirator, you must perform a fit check. A fit check for flat style respirators includes the chin pull and diamond fill for air. With one hand, hold the nose. In your other hand, pull the chin tab. Smoothing as you go. Flush against your neck. Diamond fill for air. Hands together in a half diamond. Place slightly above the respirator, breathing in and out to feel if air is escaping the respirator seal. Palms touching your hands underneath your chin. If no air escapes at the respirator seal, you may continue. If you feel comfortable and confident in your fit check, you may proceed with your duties.
I can go forward a slide.
Modern flat-style respirators include the 3M 1870.
So, Donning, we finished that slide. So we may think putting on a mask is putting on a mask, but in the context of COVID, it's not. Putting on our respirator, we need to know exactly the right way to put it on. And you notice that when Kira put hers on, she was focusing on getting the bottom strap first and the top one. The whole thing is around getting the best seal that you can get. So I can't emphasize that enough, and knowing how to fit check. So doffing, I'm sure you're ready to doff. So the order for doffing, remember, was gloves. So first of all, we take off the glove in the first hand, put it in a ball and into the gloved hand, and Kira's going underneath the second glove. So as much as possible, she's not touching the outside of any of the gloves, and hand hygiene. Okay. So next is the gown, and Kira's just done hand hygiene on her hands. So now she's going to go up with her cleanest hand as they're going to be, to just use one hand to undo the tie at the back of the neck, because she's going up past her face. So she's just going to use one hand to undo that tie, which shows us why it's really important to make it easy to undo. She's then going to use the hand where the bow is and not come across, but use this hand here to easily undo that second bow. And as she takes off the gown, she's aiming to just touch the inside and keep it contained and turn it in on itself, so the outside is not really exposed. She's keeping it away from her underlying clothes so she doesn't contaminate them. And as it gets smaller and smaller into a ball, it's then contained and put into the bin, and hand hygiene. That's the proper way to doff the gown. So what comes off next is the eyewear. So again, we don't want, even though we've just done hand hygiene, we don't want our hands at the front of our face. So we're just going to touch the eyewear at the sides and take it off. Now, if there's a space, you can put them down and clean them now with the Clinell wipes, which we might do. As I said before, you clean them on the inside first, and then the outside and the earpieces. And they can go back to the donning station for reuse. And you'd wipe the surface with another wipe, a fresh wipe, to make sure that that's not a source of contamination. Great. And hand hygiene. And finally, the respirator comes off, and it's getting the bottom strap of your respirator, catching the top one, leaning forward so you're not contaminating your clothes up here, and dropping it down into the bin. Wonderful. And hand hygiene. So that is, can we get the underlying slide again? They are the correct steps of doffing. We don't need to watch the next video. We can skip a slide ahead if that's all right. Yeah, we can go forward. Thank you. So we've got a video here and we want you to watch it. Have a look and see what you think is done well in this video. And if there's anything from what we've just talked about that you think must be improved. So this staff member has got glitter bug on her gloves and gown, AKA COVID. Anything we noticed so far? No hand hygiene?
Pull. Yep.
Yep.
Pull.
Anything? Hand comes across. Touching the gowns, touching the underlying clothes. Again, the goggles are taken off too far at the front of the face. And this, I know it's a surgical mask in this example, but the same thing, it's coming off at the front. So as she steps forward and we put the glitter bug under the lamp, we can see potential contamination and how easy it happens. So following the correct sequence and the correct ways of doffing, we aim to minimize or mitigate that risk. Just some important points to end on. So each donning and doffing station must have the appropriate signage. Many of the areas in the clinical setting are having a mirror at your donning station. So when you put on your respirator, you can check that your glasses are not underneath the straps, and you can have a look at your respirator to make sure it looks right, as well as the fit check. Once you're donned, avoid touching. I don't know how many times we do touch our masks in a day, but we need to be very conscious about it and avoid touching our PPE at all. Gloves should be changed between procedures on the same patient. So we're following the 5 moments of hand hygiene, but ensuring that all moments of hand hygiene are followed. And if you need to change other PPE because it might have become damaged or have moved, then you need to step outside and doff all your PPE according to the signage. And again, all packaging, just make sure that they are not widely open for easy access, because that increases contamination. So that is the PPE session. I hope you found that useful in understanding the correct steps for donning and the correct steps for doffing. We talked a little bit about how you get your respirator and also what constitutes a breach. But as I say, you will see Ppe Spotters out and about soon, hopefully. We aim for them to have a green label that says Ppe Spotter, so you know they're here to help and guide and assist. So we have a poll. We have an online poll that we'd like you to complete. Now, this is for people on MS Teams. We're not sure how to do it with people here in the room. But the first one, oh, this one, how do you prefer? We go to the first one. Do you have the other? Yeah. The first one asks you, how confident are you feeling with PPE donning and doffing? So if you wouldn't mind, how do they? Did I see it and just click the? Okay. Great. Extremely. All right. So this training package is, as it is, just like that, is going to be in an e-learning format. So you can go back and refresh this session as often as you need to and watch those fit checking videos, so we can build that confidence as a starting point. The next question we'd like to ask is just a quick poll, if I can indulge Janet for just one more minute. And it is, how do you prefer to get your PPE training? It's obviously a practical thing, but we can't practically get around thousands and thousands of staff. So we just want to gauge how much face-to-face we continue with now that we have an e-learning component as well. So we're matching what staff want. Okay, thank you for that on MS Teams. Any questions?
And there's a question on the chat about the 1860 mask and whether it has to be worn with a face shield or can be worn with glasses. Are you able to answer that? The fit tester said it needed a face shield.
Yep. So 60. Yes, it says on your card. So it says 1860 is face shield, must be worn with a face shield. So you do need to check, if you haven't got a card, that you get a replacement from OSH, because that will tell you if you have to wear a face shield. So that is these ones, the cup ones.
Thank you. There are 4 other hands up. I don't know if they relate to PPE presentation or broader questions.
Anybody want to ask a question? Do you need to switch? No. No. They might be left up from before. Okay, well, I'll close that session, and thanks for the opportunity again.
Thank you to Anne and Jeremy. I think we would all agree that's been really valuable, and for running it in this format to allow so many of our staff to attend. So thank you very much.
Great, thank you.
Thanks, everyone. We will review your feedback. If there's any additional feedback that you want to provide to us around the training format, that will be really helpful. The QR code, we'll just go back up. It's in the chat, and I will just re-share it. Or somebody cleverer than me will. So one of the team that's online will pull that down. That was shared earlier. So there's a few more things that we want to be able to talk about, and then we'll go to any questions, or if you have got your hand up and you can put your question into the chat, that would be really helpful. Sharon, I saw a question there from you, which was around fit testing and the waiting list for non-clinical staff. And so for staff in patient-facing areas, there is a wait list. We're concentrating on 100% compliance in areas where patients are admitted first, and then we will move through the other staff. If we find that we're not able to get through staff in a timely enough manner, we'll look to other solutions. I know that there are external providers that can come in and assist with that if we need that to happen. So we will keep an eye on that and see where we land, and you are welcome to send concerns through to the Ask Janet mailbox if there's particular issues, and we will keep an eye on that. Gunjan, if you weren't able to scan the QR code, then just type your name into the chat. In fact, we'll have yours from being logged on, but particularly if there's a group of people who are using a single computer, then we will only get one of you in the transcription. So if you've got a number of people on one computer, if everyone just pops their name and HE number in there, and we'll provide that through to C&E so that everybody is captured. If this has been a useful format, we'll run more of these forums to make sure that we can get through people. I know that there's been some issues with people coming for face-to-face and not being able to get in because it's been such a popular session. Okay, so I am just going to run through a few things, and if you bear with me one moment while I find an email so that I tell you the right thing. So Mari Slater, who's one of the nurse co-directors for acute services and at the moment is the director of nursing while Mandy's on leave, is going to come in on tomorrow night, so Friday night, on the night shift to meet staff. So she will go out and about around the hospital to chat to night staff, and the main points from the forum.
We have to be.
Tanya Basili, can you please mute yourself?
By Tuesday. So
Tanya?
when are we going to test it?
So Mari will be out and around all of the wards and chatting to nursing, to night staff of all designations, and we'll take the information from here, and we'll also capture questions from people so that we can then answer them either in a future forum, in the COVEcast format that people found useful last year, or in bulletins. The plan now around comms is to go to a couple of times a week and up to daily as required. Short, sharp COVID bulletins on the orange pro forma again, and attaching printable versions for the ward. And we will try and keep to the idea of 3 key points. So short, sharp, snappy. What are the things you need to know? And if we need to video things, or there's particular people that you want to hear from, we'll get them to come and do a video for us. If Nicole Hoskins or Graham Martindale are online, I'm going to throw to them in one moment, because we just want to talk about the people going through red zones. So as you know, a red zone is an area where patients who are at high risk of having COVID or who are COVID positive are being cared for. And you must not enter a red zone unless you are in appropriate PPE. So you've got your fit tested N95 mask on, you've got your goggles or your face shield and all other PPE that's required. With the start of RAT testing out the front of ED and the new nurse, I'm not supposed to call it nurse in a box, but I don't know what the other name for it is.
Screening zone.
Thank you, the screening zone. That's now a red zone. And so the door that was put through to exit the stairwell that's next to the green lifts exits into a red zone. And so we need to stop staff exiting through that door. Nicole, do you want to speak about that briefly and what's happening in that area?
Yeah, sure. So as Janet said there, we've got the screening zone there now. So yes, that's a red zone, and we will also be putting a fence around the ambulance bay. So that will stop people from walking in that area, because that is also considered a red zone. We do have a high traffic that goes through that area, which is putting staff at risk and the public at risk. So can we please ask all staff members on the Charlie site not to walk through the ambulance bay, and if you see patients or family members walking through there, if you can stop them as well. There will be access for which theatre can go through. There will be different access for theatre staff, and we obviously will be increasing our rat testing in the tent at the front. So as time goes on, you'll probably see more patients lining up to get in there. So yeah, just please stay clear of that area for your own safety.
Thanks, Nick. That's very helpful. You shouldn't enter a red zone unless you need to provide care to those patients. We're also going to make sure that there's really good signposting around the place, so big red signs, do not enter on appropriate doors, and that people know that you can still get out through the main G block entrance. For the Charlie site, we will be additionally locking down the doors that people come through and increasing our signage, because what we're finding is that patients and members, or families and members of the community, are following staff through doors rather than going through the screening process, and it's particularly problematic. So it's an issue in A block and at the front of the hospital. So we will make sure that all of that information is contained in comms so you can keep your staff up to date. The other change from today is that at Charlie's, the 8th floor cafeteria will move to being staff only in the seated area, and it'll be takeaway for patients and visitors. It's to reduce the number of people congregating and obviously the risk of transmission to staff. The thing we want to say about tea rooms generally and meals is, of course, people need to be able to take a break and eat and drink. But if you are in a setting where you're taking your mask off to eat and drink and you're inside, you won't ever get the tea room all to yourself. We just don't have enough rooms to go around. But if you can make sure that you're in small group settings rather than having large groups of people coming together in settings where your masks are off. The other thing is, well, I was going to say it's lovely weather. It's probably a little warm at the moment, but it is outside is always an option, remembering still to consider physical distancing, and that means that people won't be considered close contacts if following the right circumstances. The option is there for people to consider volunteering for either additional hours, even overtime, or giving up part of their work day to do some of the extra things that we need around both of our sites at the moment, and indeed that other North Metro sites are also putting in place. And that can be things like assisting with manning the door so that we are doing the vaccination checking and assisting people to get where they need to go. It might include being trained to do rat testing, and that includes non-clinical staff. We don't need clinical staff to do rat testing, but you will be trained in your PPE, making sure you're fit tested, all of those sorts of things. Ajitha is going to talk in a minute about the rat testing that's going to be undertaken and what that's going to look like. So if you do have some extra time, or you're interested in volunteering and you want to know what the options are, can you please fill out the expression of interest that was circulated on the Global? We will send out the link with the information after the forum as well as a reminder, or if all else fails, just pop an email through to the Ask Janet mailbox and we can send that through to the right people for you. That is the end of my list of things that I need to talk about before handing over to Ajitha. If you've got questions, pop them into the chat for me, and if we can't answer them now, what we'll do is answer them in other formats and through the globals. Thank you very much.
Thanks, Janet. I'll probably in 5 minutes summarize what the big changes are to the system alert response as of today. We all may have seen the global that came in our inbox last night, announcement from the Chief Health Officer that we are officially in the AMBER phase now. And this is the AMBER phase 1.2, which makes us full AMBER rather than the interim AMBER that we have been in. The most significant change in the amber phase is the more extensive use of the rapid antigen test in multiple circumstances for patients, visitors, and staff. I'm probably going to preface it by saying that the rapid antigen testing is a screening tool, and the intent of using it in the vulnerable group of patients that in this phase we are going to start doing is to protect vulnerable patients from each other, so that a positive vulnerable patient, whether that is in the cancer center or in dialysis, doesn't then transmit it to everybody else in the unit, rather than it being a test aimed at protecting us from the patient or vice versa. The intent of healthcare worker testing at this point in time, i.e. testing staff, is that with the level of community transmission, there are a number of us who may have COVID with no symptoms, i.e. we may be asymptomatic. So it is to minimize that risk of us coming to work with COVID without knowing that we have COVID, and again transmitting it to our most vulnerable group of patients. The reality, though, is that COVID is out in the community, and as we see on a daily basis, there is community transmission both to healthcare workers and non-healthcare workers, because I don't think it discriminates that way outside in the community. So in this phase of the system alert response, patients who are going to be RAT tested are all of our patients who come to the hospital for surgery, selective or emergency. They are required to have a PCR test within 72 hours of the surgery and an optional rapid antigen test on the day of the surgery. We've made the decision internally that we would be doing rapid antigen tests on all of those patients coming to the hospital for elective surgery on the day of the procedure, just because sometimes the 72 hours may not pick up a small proportion of patients. That process is being set up through our COVID clinic. The other group of patients who are going to be tested are our most vulnerable and high-risk patients who come to the hospital for day therapies. And this includes our dialysis patients, patients coming to the cancer center for their therapy, patients coming to the IV lounge, and some very high-risk group of patients in the clinic setting, again, to minimize the risk of transmission between patients, particularly where it's likely that a number of vulnerable patients are congregated or cohorted. The significant change to healthcare worker setting is that our staff in the very high risk areas, that's dialysis, hematology, oncology, and IV lounge, will need to undertake rapid antigen testing twice a week. And our staff in our other high risk areas such as ICU, ED, COVID clinic, COVID ward, which is G71, and sorry, what am I missing there? COVID clinic, did I mention? And the respiratory ward will be voluntarily allowed to undertake a rapid antigen test twice a week. I think those were the more significant changes in the rapid antigen test. The third category there is visitors, and visitors to high risk areas within the hospital. Again, the oncology ward, ICU being typical examples. We will be in full amber officially in Tuesday. You may have seen the RAT testing stations that have been set up on Watling Walk. That will go live tomorrow for a bit of a soft launch initially, testing some of our vulnerable patients starting tomorrow with a view to expanding it to all cohorts of patients who will need to be tested by Tuesday. Similarly, for our surgical patients requiring an elective surgery will start getting tested in the COVID clinic as of tomorrow morning with a view to expanding it to all of our patients by next week. The relevant areas have been contacted and we are working through that process to start going live tomorrow morning. The other important thing that I wanted to talk about was exposure. As I said, COVID is in the community and we are seeing cases on a daily basis of some of our staff being exposed in social circumstances, etc. Just a bit of information there for people who've either been notified of a positive PCR result or have undertaken a RAT which has returned positive. I think it's important that you ring up and notify your managers in your first instance and not attend work if you've returned a positive RAT test and seek advice. The North Metro Occupational Safety and Health team have extended their hours from 6 in the morning to 6 in the evening. So they will be on site from 6 to 6 on weekdays and will be available to take phone calls and provide advice on what to do if you've either returned a positive test or you have been identified as a close contact, or you know someone that you have spent time with who's now returned a positive test. We'll put up the number in the chat as soon as I finish speaking and circulate it through our globals. The OSH team's now also available on the weekends from 6 a.m. in the morning to 4 p.m. for any questions that staff may have in this space. It's really important to follow the advice that the OSH team provides, and if you have tested positive, to be quarantined and meet the requirements for regular testing until you have returned, until you are able to return to work, and then get tested regularly until day 12 of your time of exposure. Positive rapid antigen tests must be reported. There is a link online for reporting it to the Department of Health. And again, I'll put the link up here. Really important that it is reported, but also critically important that you let the managers know and not attend work and wait for further instructions or directions if you have been exposed to a positive case. Really important to note, and the really important message is not to panic. So if you have a staff member or a colleague who's identified themselves as just returned a positive test, or have been in contact with someone who's returned a positive test, important thing is not to panic. Move them to a separate part away from patients, staff, visitors, and contact OSH for assistance. After hours, it will be the medical executive on call, available 24/7 through the switchboard for advice, guidance, and support. I think that's the two important things that I needed to talk about. Any questions? Feel free to put them up on the chat or send it out of this session, and we'll aim to have it answered as soon as possible. Thanks, Janet. Back to you.
Thanks, Ajitha. I note all the questions from Pulm Fizz and respiratory. So Bajan will come back to you and your team in the coming days once we've had a chance to review that. Damon's asked about working from home for furloughed staff. And Damon, there's not one blanket rule on this. There is a working from home policy and application process, and where staff have duties that can be undertaken from home, even or a proportion of duties that can be undertaken from home, and have also gone through an appropriate assessment of the safety of their home workplace to ensure that we would not be putting them at risk, then often furloughed staff will undertake working from home, providing they are well and not unwell with COVID and should be resting, as opposed to working from home and then not having chance for a good recovery. Does that answer your question? Is there anything specific you want to know? I'm going to take that as a yes unless I see something on chat.
Yeah, the current process, Janet, to get the permission for IT and OSH, it has to go to you first before we can actually go through that process.
So Damon, they're coming through thick and fast in my mailbox, and I'm churning through approvals today. As it happens, I think I've approved about 60 of them, which are where departments have identified that in the event that a staff member is furloughed, there are tasks that they can undertake rather than having work that's not covered, and they're coming through. So I'm working through those as we speak. If you've got particular concerns or issues, just flick me an email and we'll work through it.
No problems.
Thank you. Alice, we will take that question on notice about access to COVID leave, and we might get someone like our HR leads to do a bit of an update in the COVID forum around what are the HR provisions surrounding COVID leave and how you access to it and what circumstances that you're eligible for it. So we'll get one of the HR or IR team to attend the next forum so all of those questions. So what I would say is if you've got HR or industrial relations or leave questions from you or your staff, send them through to that Ask Janet mailbox and we can make that a bit of a focus for the next forum. Thank you. So that's the list of things that we particularly wanted to talk about in this forum. Only to add that there's a really stressful time coming. We know that it's been difficult to staff areas generally, and that furloughing of staff is going to add to that difficulty. We need to pull together and be able to get through, and we'll continue to support areas. If you need additional support, please do email through to us so that we understand. If you've got ideas about things that would make a difference for staff in the wellbeing space, please do let us know. Salam, there are some specialties where outpatient clinics may be managed by telehealth by staff in isolation where it's appropriate, and that's able to be done by a clinician at home. So there are measures in place for some of those clinics and some of those patients, providing there's access to the systems that are required. So I really want to thank everybody for the enormous amount of hard work that's been done in the last 6 months, 9 months, 2 years, because it has been a sustained effort. And without our staff, we actually can't ever do what our patients need from us. I'm incredibly proud to work at North Metro and more specifically at Charlie's Aussie Park, and I'm proud because of our staff. I know it's hard when you read all sorts of things in the media, either about us or about the health system more broadly, but I would like to say to all of you and to all of your staff that you're doing a phenomenal job and should be incredibly proud. Any questions that you have, comments, feedback, do send them through to Ask Janet. If there's things you want to see at future staff forums, please do let us know. Let us know if it's useful, if you want us to continue them, and that we were considering running a weekly PPE training session in this format online for staff to log on to. So if that's useful to be able to get larger numbers of staff through and then allow CNE to focus on that auditing, understanding what it's happening in practice piece, then that's what we'll do. Any remaining questions or comments from anyone before we wrap up? Okay, can I thank you all for your attendance? It's greatly appreciated. I know it's quite a chunk of time to take out of your day, but we really appreciate having you here. Thank you.